Welcome to Spilling the Tea with Dr. Joyce, a podcast that goes deeper than the highlight reel on social media. I'm Dr. Joyce Park, a board-certified dermatologist, content creator at Tea with MD, and founder of Skin Refinery Dermatology Clinic. Each week, I will be joined here by a remarkable guest, and together we'll discuss stories and strategies for balancing our challenging careers with our personal relationships while making time for beauty routines and self-care. So grab your favorite cup of tea, get comfy, and let's get ready to spill the tea together. Hi everyone, welcome back to another episode of Spilling the Tea with Dr. Joyce. I'm a board-certified dermatologist, and today we have a very special guest, Dr. Kerry-Ann Mitchell, who is not only a renowned neuroplastic surgeon, yes, you heard that right, it's a very, very highly specialized field. She's also a very good friend of mine from Stanford Medical School. So thank you so much, Doctor, for coming on this podcast today.
My pleasure. Thank you for having me.
I put together a small biography just so we can all get on the same page about what you do and all your accomplishments. So I'm just going to read through this and then we'll dive right in, okay?
All right, sounds good.
So Dr. Kerry-Ann Mitchell is a plastic and reconstructive surgeon specializing in neuroplastic surgery, and we're going to talk about what that means. Renowned for her expertise in complex scalp reconstruction, cranioplasty, and patient-specific custom skull implants. She is currently on faculty at Ohio State University. She is a graduate of the University of Utah and Stanford University Medical School, where we became lifelong friends, by the way. And she completed her plastic surgery residency at USC and neuroplastics fellowship at Johns Hopkins University School of Medicine. Dr. Mitchell is originally from Jamaica, and in addition to being a surgeon and researcher with a lab, she's also mom to her son Lucas and her daughter Zuri. Welcome to Spilling the Tea.
Thank you. Thank you for having me here.
All right, so let's start at the beginning. I always like to go back in time and hear about your story because you have an especially inspiring and perhaps non-traditional path into medicine. So how did you end up in medicine? When did you decide you wanted to be a doctor?
That's a very, I always get asked that question, and I say I don't remember a time when I didn't want to be a doctor. So I think as early as I can remember when I was a child, I wanted to be a doctor. Grew up in Jamaica, as you mentioned before. So I grew up in a very, very small town, very rural community. I knew pretty much all my neighbors, but we didn't see doctors. So we had community nurses who would have monthly clinics. And if you were a child and you needed something like your vaccines or routine school physicals, the community nurse would do those things. And then if you had a problem, then you would get sent to the doctor. So I never saw a doctor growing up for a long time until my younger brother was born. And then my younger brother had epilepsy. And so that was the first time I became aware that, hey, this is what you do when you go see somebody else. And I really think that was so impactful for me to know that, hey, there is somebody who can take care of if you get really sick, not just your routine care, but if you're sick and you need to see somebody, that would be a doctor. And so I've always wanted to be a doctor since then. Yeah.
Wow. So it really was experiencing doctors and the care system through your brother who was a patient
Right, exactly.
that inspired you. I actually have a similar story. I don't know if I've ever shared this publicly, but my younger brother was born with cerebral palsy. And so we did have a lot of doctor visits, and he went through multiple surgeries when he was a child. And that also kind of inspired me and made me interested in medicine because you really feel as the patient, you really feel the impact of good doctors, and good doctors are hard to come by. So I have a similar story. And growing up in Jamaica, where you were so far removed from, the US and the medical training system here, how did you even learn about, all the steps that it took to get to Stanford Medical School?
That's it's so funny. I never even knew about Stanford or any of that, right? So when I was growing up in Jamaica, I thought I was going to go to the University of the West Indies. It's the one medical school in Jamaica, And pretty much, if you wanted to do medicine, that's what everybody did. Very competitive and super well recognized medical school. So it was challenging to get in. But then if you grew up like me, where you're poor from rural Jamaica, even that seemed like such a big, lofty goal to say, I'm going to go to medical school in Jamaica. And so I graduated from high school when I was 15. And we were so poor, I didn't even go to the second level of high school, right? So the second level of high school, which would have been probably similar to pre-freshman year. But I started working as a waitress after I graduated from high school. And I was like, okay, fine. This isn't a big deal. This is what life is like in Jamaica. I'll save my way and then make my way to medical school. And while I was working as a waitress, I met a recruiter from Benedict College, where I went to college. And she was on vacation and she told me about Benedict. And she said, oh, there's this college. I'm a recruiter. That's what I do for my job. I'm on vacation, but that's what I do for my job. Why are you working as a waitress? Why are you not going into college? And so she told me about Benedict. And this is incredible. She said to me, you can get a scholarship to come to the US, but you have to make 99 percentile on the SATs. And I was like, okay, I'll make 99 percentile. And I did make 99 percentile on the SAT. But
Of course
I
you
applied
did.
to one college, and it was Benedict College.
Wow.
That's literally the one college I applied to and left Jamaica in 2000 to go to Benedict.
Wow.
And so I went to Benedict for 4 years. And then while I was at Benedict, Benedict does not have, at that time, did not have a very strong pre med program. So they had strong research opportunities. So I ended up doing a lot of research while I was an undergrad. And that sort of propelled me into a PhD. And not surprisingly, I wanted to do epilepsy research because of why I even came to college in the first place and why I wanted to do medicine in the first place. So I ended up doing a PhD in neuroscience where I developed a model for epilepsy research.
Wow.
And that was when I realized I actually do want to work with patients. I love research, but I miss the patient care aspect of it all. And that prompted me to apply to Stanford. So I finished my PhD and then did a year of postdoc research. And during that time, I did my MCAT and all the standard medical school application things. And then came to Stanford.
What an incredible story, Carrie-Ann, because also, like, looking back on your story, sometimes you can pinpoint a moment in time where something happened or you met someone that it
Mhm.
just completely changed your life. It altered the course of your life. And meeting that recruiter from Benedict
Mm-hmm.
changed your entire life.
Entire life. She was just on
Do you still
vacation.
keep in touch with her?
I do. I do.
Oh my goodness. I mean, you must be her star recruit.
Oh my
Like, what a
God.
story.
Yeah, it's incredible. Like people just talking to people, because she could have come and just enjoyed her vacation and not had a conversation with the waitress, right?
Right.
Yeah.
Yeah, that
Yeah.
is really
Mhm.
incredible. And I imagine coming to the US from Jamaica, it must have been quite a transition and possibly a culture shock. What
Mhm.
was it like when you first moved here for college?
It was culture shock, but I will say I am forever grateful that I went to Benedict because it is a small, historically black college. And I think I felt welcomed, I felt loved, I felt like it didn't feel like such a huge difference from Jamaica. Like it's a much small institution at a time. It was like 2,500 students total. So
Mhm.
I knew my classmates. I remember I would go to my teachers' houses for Thanksgiving because I didn't have family to go anywhere for Thanksgiving, for holidays. My teachers would invite me home for Thanksgiving dinners or for,
Oh,
things like that. So I never felt like I was so separated from anything. But I'm forever grateful for that because it was such a small, intimate environment. And then after I graduated from Benedict, I think that was when it finally came to me like, oh, the world is much bigger out there. But yeah, yeah.
yeah, because then you moved to Utah to attend the University of Utah, and I imagine that's very different from Benedict.
Very,
What was
very.
that experience like?
That was a huge culture shock. I think it was really hard adapting to Utah, both from being Jamaican and from coming from Benedict. But I also think my program, so I was a neuroscience PhD, I had an excellent program and I met lots of nice people. I still keep in touch with one of my dear mentors or multiple of my mentors from Utah that I still keep in touch with and still give me research advice to this day.
Wow.
So I met wonderful people. So I think even though sometimes like you're in an environment where things are just so different, if you connect with people, it really helps. Because I now
Right.
at
It
last I was like 4 years in Utah. Whoa, but yeah,
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 having good mentors and people who support you make all the difference.
it
I
does.
truly believe that. And that kind of ties into my next question, which was I remember in medical school, you and I both were flip-flopping between what specialties we should apply into. I thought I was going to do ophthalmology. You thought you were going to do neurosurgery for a while. How did you end up in plastic surgery? And then, specifically within plastic surgery, how did you decide on neuroplastics? Such a specialized field.
Oh my goodness, I remember that very well. And I talk about it often because I meet students who ask these questions like, how do you decide, right? And so I always knew I wanted to do something with my hands. I love working with my hands, I'm very technically oriented. And with my background in neuroscience, that neurosurgery seemed the most logical. So I did a lot of shadowing and I felt, okay, this seems like a good pathway for me. So I didn't know that until my third year of medical school, once I did my neuro ICU rotation. And I realized that a lot of the patients are just very, very ill. And then it's more about the neurosurgery saves lives, right? So patients come in with these devastating injuries and they require you to save them their lives. But many of these patients go on to not really have a great quality of life. And I realized that for me, it was very, very challenging to deal with mentally and emotionally, that you're going to do this and the patient may be alive, but sometimes I said to myself, what's the quality of life and how can we make this better? And so I was more on the recovery pathway, and that was what made me start questioning my decision to become a neurosurgeon. And plastics, I think plastics stumbled on me because I was just doing my plastics 2 weeks rotation. And I remember the exact case that made me think, okay, this is what I'm going to do. But it was a patient who had a squamous cell cancer. We did this very long, complex microsurgical procedure. And I remember thinking to myself, wow, why are we putting this patient through this? What's going to be his quality of life, you know? And I said that to Dr. Gordon Lee. I told him this recently that he inspired me. And I said, why do we do these very long surgeries? Like, what does it mean for a patient's quality of life? And he said, even if it's a cancer that could, this patient might have 6 months left to live, he may have a year, but he's going to go home with his family and have a face, right? And that hit me like, huh, that's quality. Even if you have 6 months left, you go home and you're with your family, and that's what you want. And I was like, okay, that's what I want to do. And I switched, and I mentally switched to plastics. And then every time even now in my career and in my life, I'm always forever grateful because I feel like I have the ability to help impact quality of life with whatever I do. Even if it's so cosmetics, you may say, oh, I put some lip fillers in, right? That patient leaves that office so happy and grateful, right? And their confidence is boosted. Or it may be a very big, like a cranioplastic surgery, and it's still the same impact that it helps their quality of life. So that's what's important to me. And that's
Yeah,
why I
that's
switched.
That's very inspiring. And I think on social media and on TV, people have a certain perception of plastic surgeons and the work that they do. But in reality, you come across and you do all sorts of different cases, not just cosmetics.
Right.
And because your field is so specialized, neuroplastics,
Mhm.
like I don't even know, frankly, like what you do on a daily basis and
Right.
what types of cases you work on. So what are the types of things that you do? What are your patients mostly suffering from? And what are your surgeries like?
Yeah, so neuroplastics is a really new field or a new subspecialty of plastic surgery. And it came out of the thought that we do craniofacial surgery where we fix the scalp and the skull, but it was primarily rooted in pediatrics, so where we take care of children. And
Mhm.
most of those surgeons are based in pediatric hospitals. And so when you're an adult, for example, a patient who was involved in a motor vehicle accident and they have brain injury, and their skull gets taken out and they need a new skull replaced, they're probably just having a neurosurgeon do their surgery in most places. And if they have a problem, then they get referred to plastic surgery. And so it begs the question, if we provide multidisciplinary care, where if you're a child and you have these devastating injuries, or if you have breast cancer, for example, you get a plastic surgeon and you get the other surgeon as well working together to prevent you having these complications. And so neuroplastic surgery is that we can cure for adult patients in a multidisciplinary manner to help prevent these complications and also help restore what patients look like at baseline. And so a significant
Okay.
part of my practice is fixing the skull. So after trauma or strokes or cancers, but most of it, and I have my little model, I'll show you my little model. But like this is a model, so you can see this is a skull, this is a
Yeah.
true patient skull, and this is what an implant, this is one type of implant. There are many, many types of implants. So
Wow.
you can see if they had a hole in their skull, you can create a custom implant so their head looks nice, right? And then they go back to work. Nobody can tell that they had the surgery or that they have a plate in their head, for example, to repair their skull. So I do a significant portion of my practice, but then I also do our typical reconstructive plastic surgery, breast reductions, breast augmentations, tummy tucks, eyelids, facelifts. Yeah, so
Oh,
the
wow. I didn't know that actually. I didn't know that you do other procedures as well. So it's
yeah,
the full breadth of
full
plastic surgery.
mhm,
Wow.
yeah.
Okay, that's very cool. I like that model. I was admiring all the little skulls behind you. It's like it's
Yeah,
Halloween.
yeah, I know.
My son would love that. That's his favorite holiday.
Oh, really? Oh my goodness. My son loves Halloween too.
Switching gears a little bit, and I always love asking this question to my friends and colleagues who are especially in male dominated fields. I
Mhm.
always ask, in the course of your very long medical training, are there instances where you feel like you faced either racism or sexism, as I'm sure a lot of us have? And how do you handle that and move beyond that?
It's a very interesting question. So I think in the sense, so plastic surgery is a male dominated specialty. I think in from your colleagues, it's very rare. In my experience to get overt racism where somebody will say something to you that's just clearly like they would know it's racist and you would know it's racist. But what is less likely, what is more common is the subtle racism that people may not think about that is racism, right? So people will say to me, like, oh, you speak so well. Right. And like, what does that mean? I have two doctorates, right? Like, what made you think I would not speak well, right?
Right. You have more education than many people like all combined together.
But like those kind of, so that is a, but then it's the implication,
Mm,
or somebody will say to me, or I've heard this many times where people will say, "Oh, this like you'll say something that's overtly stereotypical, like this patient is pain seeking or drug seeking or whatever it is, right?" And they will say, "What made you think that?" Right? There's nothing in their history to point to that. What makes you think this patient who just had this very big surgery that I just performed would make you think
right.
that they don't need the pain medicine that I'm telling you that they need, right? And so, and then they'll say, but you're not like the others, right? You're different, right? And I'm like, no, I'm not. I'm the same. We're the same, right? But those are more subtle, where they're not necessarily like nobody's saying I hate black people, for example, right? That's like
Right.
very, that's very overt. It's the more implicit biases that people have that you're not aware of, and I get that all the time. Or even
Wow.
that people will often ask me to speak on DEI issues, for example, and I'll say, I'm a neuroplastic surgeon. What makes you think that you can ask me about DEI issues? That means you're asking me my personal lived experiences, right? That means you're assuming that my personal lived experiences are for you to use for whatever it is, right? Or I'm like, are you? Whereas this person who probably specializes in DEI, are you paying them to do it? Are you going to pay me to come on
Mm,
your panel and talk about these issues, right?
right. Right.
Or ask me about my research. And I always remember the there's a quote, and now I'm blanking on her name, and I'm gonna look it up and tell you afterwards. But she says, uh, the 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 point of racism is distraction, and it keeps you from focusing on the things that you need to do. And I've always internalized it, and I think about it, that if you focus on the things that people try to keep you down from, then you don't focus on the things that you need to be doing. And so for
Mm,
me, I try to just like not let that, like, that's like your problem. right? I've had patients who say, I wasn't sure I wanted a black doctor, but you're really nice. I've had
Wow.
patients say
How
that.
do you respond to that? What do you say?
And I say, oh, well, I'm glad you think that. Now let's move on to your whatever your problem is or your complaint is. And I tend to think to myself that this is something that patient and I will probably never see eye to eye on, and I don't necessarily see it as I can't change your biases in this interaction. What I can do is I can fix your skull. So let's just do that. You know,
Right.
so
Yeah.
so,
Yeah.
so
Yeah.
maybe
You
it's not
focus,
the
you
best
keep it professional. You keep it professional,
approach.
you move along, and I go back and forth on this too, but sometimes you don't have the mental energy or the
Right,
time to be
right,
doing the instruction,
right,
right? Because
right,
they need to be doing the work, and
right.
you have a lot of other things to focus on. So,
That's why I always
um,
appreciate when I have like people who are maybe not black people who will speak up on my behalf, and I'm like, thank you, because right now I'm out of energy to deal with this, right? It's always, and I have plenty of friends who do that, and it just fills my soul. So
Yeah. Oh, well, thank you so much for sharing that. And I know this isn't a question that we had talked about before, but it just came up to in my mind as we were chatting. So
mhm.
your husband is Caucasian, right?
Yeah.
And so you're raising multi-ethnic children.
Hmm, hmm.
And I guess my question is, how do you raise your kids to be kind of cognizant of some of the challenges maybe that may come with
Hmm.
growing up in a multi-ethnic family? Um, I know we can't protect our kids from everything, even though we try, but what are maybe some of the challenges that you might have encountered with that?
That's so interesting because we just recently moved my kids to a new school, and part of the reason was I just think diversity is so critical to me and to my kids. And I jokingly said to my husband, like, we need to move my kids because I can't be the only black person that they know well. They need to know other black people, not just me.
That's right. That's right.
So you need to see other black people around you, right? And so I
Yeah.
think diversity is so critical, but on all levels: economic diversity, racial diversity, religious diversity, just to understand that there are all these people around you. And and when you think of minorities, like my kids are even more minority than I am because they're biracial kids, right? And so I think they'll face challenges that I don't even know how to predict that they'll face. And so I want him to be able to cope with that. Like whatever that may look like in 10, 20 years from now, I want him to be equipped with that. And I think just being exposed to different things and being aware that people are different and that it's all okay will help them deal with that. Yeah, but
Yeah.
I think just making efforts to make sure that people are exposed to diversity is important. It really matters.
I love that point. I think that's so important because it can be very, very easy to get sucked into these bubbles. Like
Mhm.
even where we trained, at
Mhm.
Stanford,
Yeah,
it's such a bubble.
it's a
Like
bubble.
there's not that much economic diversity in Palo Alto, let's be honest. And even ethnic diversity, there's not
Mhm,
that much in the
mhm.
neighboring towns. So it's like as parents, we have to be intentional about
Right.
introducing our children to different types of diversity in their schools and in their communities. And so that's a really important point that you bring up. So thank you for sharing that with us.
Yeah.
And speaking of children, one thing that I really wanted to cover too was you have had a long training, very busy, very demanding, and you had children. I wanted to ask you, when did you have children during your training? And what advice do you have for students or trainees who are maybe thinking about family planning, but also trying to juggle a career in medicine?
Hmm. So I think it's such an important topic, and we talk about this in plastic surgery not often enough, but we talk about it a little bit. And there's more research coming out. But a big part of women in medicine is having struggles to trying either on the whole process, whether it's trying to conceive, carrying the pregnancy to term, or even raising the children, being able to take care of the children the way you want to. So all along the spectrum, women in academia and in medicine and surgery tend to struggle. And a big part of that, we talk about older ages because the training process is so long. And so that puts them at a disadvantage. But not just that, but even younger people, it probably has to do with the stress of the training environment and not being able to be at a health that they would need to be able to do all of those things well. And so um, I think I was very fortunate in the sense that when we decided, I had been married for probably 8, 9 years. So my husband and I have been together for 17 years almost. So
Wow, I didn't know that. Congratulations. That's a long time, almost 2 decades.
we were so young when we got married, and we got married like 6 months after dating. So
Wow. When you know, you know.
I think he knew more than I did. And but yeah, so we all through medical school, and then by the time I got to residency, and I knew we wanted children, and so there was never going to be a good time. I realized plastic surgery is 6 years of residency, and so I knew there was never going to be a good time. And so when we decided that okay, let's just do it, we just decided to just go for it, and it was never a good time. So I had my son in my 4th year of residency, and could I have had him earlier? Sure. Could I have had him later? Sure. But I think that was what was right for us as a couple. My husband did his MBA, and he was in Japan and doing a lot of back and forth between Japan and Dartmouth for his MBA. So it wouldn't have been a good time to do it earlier for us because the long distance wouldn't have really been good. And so when he came back and moved to LA, then we were like, okay, now is a good time. Um, but I will say my advice to people is just that just do it whenever you want. If you know you want children, don't just do it. Don't wait. Um, and then my son, Lucas, I always think he was like one of the best things that I ever did, or best decisions that I ever did. And I think he made me like such a stronger person. And I will tell you, do we have time for me to tell you a quick story? But
Oh my gosh, yes. I love all the stories. Yes, please.
so one of I was when I was a resident in and my son was born. So my son was born Thanksgiving, so he just had a birthday a couple of days ago, and he was born. And then at that time, it was a 4 weeks. You had 4 weeks vacation, so you use your 4 weeks for maternity. You have no more. That's it. So I went back to work the 1st of January, and
Oh
I
my
was
gosh.
on a heavy rotation. And one of my dear mentors, Dr. Randy Sherman, and he passed away recently. May his soul rest in peace. But he's like a just this amazing surgeon, amazing human being. And I went back and I was on his service when I got back from having a baby. So I'm like in a mom brain fog, right? And here we are, and we're doing these surgeries, and he does these big complex surgeries. The first few days,
Oh,
I was like, okay, I look up to this person so much. I'm not going to scrub out. I'm not going to take breaks. And I started to develop mastitis because I
oh
was like trying
no.
to breastfeed this child and trying to do these surgeries. And so then I went home one day, and I just had this revelation. I'm like, I can't do this. My child, he would not drink formula. Everything made him sick. And I was like, I actually am one of those lucky people who make milk. And I'm creating this problem by not pumping and not doing all the things that I could. Like, not everybody can make milk, right? And here I am. My child can't drink the formula. The formula is making him sick, and I can make milk that makes him well. And I'm not doing it because of the job or because of my career. And it just
Yeah.
was this thing where I made that choice that no, this child is my priority. In this moment, this child is my priority. And so I showed up to work one morning, and we had a gracilis free flap. It's me and Dr. Sherman. So I go up to him and I say to him, Dr. Sherman, we have this big, long, complex case today. At 3 hours, I'm going to need to take a break and step out. And he kind of gives me this odd look, and I said, I need a pump. And he goes, what? What? And I said, I'm actually breastfeeding and I need to pump breast milk. And he goes, oh. And he kind of looked away from me. He was so embarrassed. And this is so plastic. That's what he does all day, every day. And does like amazing breast surgeries, right? He made the most beautiful breast. And that's making me so embarrassed. And then he goes, okay, do whatever you need to do. And so And so he said, okay, so that we're under the microscope, but we finished that part of the case. And he says to me, now is a good time to scrub out and do whatever it is you need to do. But he couldn't like look me in the eye and tell me. But for the rest of that rotation, that man, we're in clinic, he would say, take a break. And I would know that's
Mm,
him telling me to take a break. And so when you think of like people supporting people in a way that you never expected to get it, he's like, he used to be the chief of plastics at Cedars, like a big, and he would always, always tell me to take a break. And he would always just look out for me in a way that I wouldn't have really known to speak up for myself and ask.
yeah.
But yeah, and then the last time I saw him, like I saw him like last year, and he always says to me, "How's the baby?" And I jokingly said to him, I said, "He's 6 years old, and I'm not breastfeeding anymore."
Oh man, that is some story. Wow, like thank God that your mentor that you're attending at the time was understanding and that, you
Mhm.
know, it's funny that it's such a low bar that we've set in medicine
Right.
that for your boss to say, yes, you can go pump, we're
Yeah.
like so grateful for it because I can imagine in surgery it is so
It is
difficult to
so
scrub
difficult.
out and you don't want to be seen as weak or
Mhm.
lazy, even though obviously you
Mhm.
wouldn't be any of that for pumping.
Right.
But there's just a stigma against
Mhm.
moms and
Right.
doing the things that
And
moms have
things
to
that you
do.
do. And nowadays, thankfully, we have like willow pumps, right? So we have wearable pumps that you can pump in the OR, or you can pump wherever you need. And there's still stigma. People will still say, "Oh, should you be doing that?" Yes, yes, you should. Like when you menstruate, you still operate, right? So it's a bodily function,
Right.
you know.
Right.
But yeah,
Yeah.
yeah,
Normalize. We got to normalize all these things that moms do because
yes,
we're not just taking breaks or slacking off.
right,
It's hard work keeping a baby alive, growing a baby and feeding a baby and
right.
doing all the things to keep them alive. And
Mm-hmm.
I also wanted to ask because I've known Cash, your husband, for a while now, ever since we were in medical school. And he is just such a supportive spouse, supportive father. And I love talking to women, especially women in medicine, about how each of our villages look. Because we always talk about how it takes a village to raise a family. And
Mm-hmm.
so, with you being in a very demanding career, what does your village look like? What role does your spouse play? If you have family, nannies, outside help, what does your village look like?
Right, it does take a village. And I learned this a long time ago, outsource where you can, right? And like focus on the things that you can focus on. And so for me, I think my husband is like my backbone. Like he's my strongest supporter, always has been, always will be. He's just always there. Um, when we decided to have children, it was with the recognition that he would have to be very active. So I always say, I even now, in now my kids are 3 and 7. My son just turned 7, but even now, one of the things I can, if I'm in the operating room, I can totally just be in the moment and not worry about my kids, right? So, for example, we split drop off and pickups for the kids, and if I'm in the OR and it's 5 p.m. when it's time for the kids to be picked up, I don't have to worry that, oh, it's my day to pick up, because I know if I don't pick up the kids, he always calls me, even on my day when it's my day to pick up. And I'm like, I got it, I got it. He's like, okay. But most of the times, if he calls me and I don't pick up, he just goes and picks up the kids. Like it's
Wow.
not a tit for tat. Like if he picks up 100% this week, it's okay. He does it and he doesn't complain, and he knows that this week was just a rough week for me. And I think it's just learning that I'll do as much as I can in one aspect. Like I always plan the kids' birthday parties, so I can say, like, for example, there's certain things
Right.
that I'm the one who always does, and we split our duties. But I also believe in like outsourcing, and so we have someone who helps to clean the house, and so it makes space for my mental wellness that I go home to a clean house. But I wouldn't have the time to do it the way I want to do it, and so I'm so grateful we've had the same lady who's cleaned for us by 2 years now, and she knows us so well, and she's just in tune with us. And so I consider her a part of my village. Like, this is somebody who I trust. And then we have just dear friends, like one of my friends, Pat, who she's Jamaican. I think Jamaicans form villages wherever we go, but we reach out to each
Mm.
other. So I know if I'm in this town, I know Jamaicans here, so I can always get Jamaican food, or somebody will make me some good dinner. You know?
That's important.
Yes, yes. So she's a part of my village. If I needed somebody to pick up my kids and my husband and I couldn't do it, she would completely help bear the burden of that. Even though she's not necessarily somebody that, okay, this is your duty every week, but I know I have that support. So it helps to take off the emotional burden of wondering what would happen if you weren't able to do something.
Yeah, absolutely. Having a village is so important.
Agreed.
We used to live just 15 minutes from my parents in the Bay Area, and that was so nice
Yeah.
because my parents watched my son all through COVID while I was
Oh,
working.
oh wow.
And, we couldn't really, it was hard to find a nanny, hard to find a daycare at the time, and he was a newborn.
Hmm.
And so I'm eternally grateful for them. And then since we moved to Seattle almost 2 years ago, it's been a bit harder because we're away from my in laws who are in Jersey and my parents who are in the Bay Area. But luckily, both sets of grandparents are retired and they're pretty active in coming to visit us.
Hmm.
So we have a good number of weeks that they're here with us. And
Hmm.
then we also had a nanny plus school. And so I think it's always great to hear from other families how they make it work because every family has a unique setup that that makes it work for their specific family situation.
And I will say, like my mother-in-law, who is just this dear human being, but my kids love her, and she visits whenever she gets a chance. She visits, and when she visits, it's that time when I think I can just exhale because I don't even like. If there's no food in the house, she will go grocery shopping and put food in the house, right? So it's different from somebody who you're paying to help you, because they may be a little bit hesitant, like, what should I feed your children? She's gonna feed them whatever she wants to feed them, right? So it's
Right.
like their grandmother, so she takes care of them like her own, and I trust her to do that like her own. And so she's also an incredible. She lived with us for like 3 months after my son was born. She flew out to LA, lived with me while we were a resident, and took care of my newborn. So yeah,
Amazing.
it's a village. It really, really is.
Yeah, we're in the process of trying to convince both sets of grandparents to move to Seattle. This will be a long play, but we are planting the seed. So, for
Yeah,
anyone out there who lives close to parents, you're very lucky.
absolutely.
All right, I know we're going on long here, so I just have one last question that I wanted to ask you, which I like to ask all of my guests.
Mhm.
You are extremely busy, mom, surgeon, researcher. What do you do for self care and how do you work that into your life?
Yeah, so it's so interesting, but I think for me, the quiet time, and I think the more I'm realizing that not necessarily quiet like quiet around, but time when you have no other obligations. And so for me, that's working out. And so I went through a time when with COVID and all of that, and I found that I wasn't exercising as much as I would like to. And then with a new job and a new schedule, and kids, it's really really hard to fit in exercise. But then I realized that that affects my mood, that affects my productivity, it affects everything around me, right? And so now actually started working out at 5:15, so I get up and
In the
in the
morning?
morning. So
That is admirable.
I get up,
A woman of discipline.
and I think, and it's so funny because I think to myself, it's a challenge every day. It's never like I just want to get up and go do that. And sometimes I tell myself, like, you don't have the luxury to not go. Okay, you have to just go. And
Oh
so I
man.
do a workout class, and then that way I can be done by 6 o'clock, 6:15, and get, like, surgery starts at 7:30, so I have to be done. So I just quickly shower, get dressed, and go to the OR for my 7:30 start. But that actually is probably my only time for the day when I'm completely just focused on me, is that hour, and it really really helps.
Oh, that is so important. Having that precious hour. It's good for your physical health, it's good for your mental health. What's your exercise routine of choice?
Lately, not lately, maybe over the past year, I've been going to Orange Theory. So I think it's great because it's somebody telling you what to do for an hour. So you don't have to think about the exercise. And a lot of it is running. So you're on a treadmill and you get to listen to some good music, and you run on a treadmill and the coach coaches you through what you're doing. And I always feel like I get a great workout. I never go and think, oh, that workout was kind of meh. Somebody else is thinking of how to keep it not boring, which I think if I were to just go to a regular gym and have to think of the exercises myself, I wouldn't go. But so I've been doing archery for a while now, and I really really like it. It's just I feel I don't have the luxury of being bored. I just get the exercise done and be done. So
Well, you certainly inspire me to work out. My workouts might have completely stopped basically during this pregnancy, but after I deliver this baby, I'm going to get back on my Peloton and get back into a routine that I'm really excited for. So,
you're growing a whole other human. Okay.
a little distracted right now. That's true.
Yeah.
So, Dr. Kerry-Ann Mitchell, my dear friend Kerry-Ann, thank you so much for being on Spilling the Tea with us here today and for having such an honest and open discussion with us about all sorts of topics that we don't discuss enough on social media, but we really should. So,
Mm-hmm.
in closing, can you just share with all of us where people can find you online, like your handles, what platforms, so that they can follow along on your journey?
Absolutely. So probably I'm most active on Instagram. So on Instagram, I'm the skull surgeon, sort of a little play on
Love
my
it.
work about the skull surgeon. And then on Twitter, I'm Dr. Kerry-Ann Mitchell. I'm on LinkedIn, Facebook as well, just as Dr. Kerry-Ann Mitchell. Um,
Amazing.
and I am currently based at the Ohio State Plastic Surgery, where I have a practice. Always taking patients. I'm happy to see anybody for a consult. Not just my neuroplastics, but any sort of plastic surgery procedures. And those are all listed on the Ohio State Plastic Surgery website as well, so you can see those.
Yes, everyone go see my dear friend Kerry-Ann. Well, thank you so much again for the time, and everybody can find you online for more information. And I miss you, and I hope to see you and your family soon. Thank you so
Soon.
much again.
Take care.
Bye. Thank you for joining us today for our real, unfiltered conversations. If you haven't already, don't forget to hit subscribe on your favorite audio podcast platform. And if you're more visually inclined, all of our video podcast episodes are available on my YouTube channel at Tea with MD. For more beauty and skincare content, don't forget to check out my Instagram and TikTok at Tea with MD. Remember, life isn't just about the curated content we see on social media. It's about these real conversations we have with each other. So continue spilling the tea with your friends, family, and loved ones. And together we can create a more open, connected, and authentic community. Until next time.